How students can best prepare for clinical, in the first light, I think, is to relax. I know that every student I've taken out, when I talk to them about their feelings on that first day, whether they're first, second or third year, they're always tense. They always tell me that they're worried about the environment and they haven't slept the night before. So I expect to find that in a student on the first day. But I tell them that they need to relax. They need to come with information about what they can and what they can't do. They must have looked at the objectives so that they're aware of what's expected of them in the clinical environment. Then I suggest that that first day, when I'm trying to get them to relax, they look at those things which they have read up on and how they can achieve in that particular clinical environment, which we can discuss in that afternoon's debrief. So I guess they ask them to relax, to know what's expected of them, what they can and they can't do, come with a sense of motivation and a preparedness to engage with the environment, whatever it may be.
It is very important to talk to the patients as you do things, because you're building a rapport with the patient, and then you can get more information about the patient, you can assess the patients better. But in order to do this, you need to prepare yourself first, because normally the conversation stops because either the patient doesn't understand, or it's too much trouble for the patient to try and understand what the student is saying, or it's very difficult for the student to continue the conversation because they do not have enough sentences to actually start it. So they need to come prepared for the clinical, before their first clinical. They need to prepare a set of sentences or questions that they might need to use in a general conversation, and practice saying it smoothly and clearly and loudly so that the patients can understand it better. They also need to run it past somebody in order to check whether they are understood or whether it's clear as to what they're trying to say.
Obviously, you need to be organised, make sure you've got your CRC and your vaccinations, otherwise you will be sent home on day one and get no clinical. Again, be aware of your subject content and what you need. It's your clinical placement, it's not the staff's or mine, it's yours, what you need to get out of that clinical placement. And as much as possible, have your other assignments and things done so that you can be getting good night's sleep and coming to clinical enthusiastic and focused and be able to make the most of the learning experience. I'd probably say I don't think I could fully prepare you for that experience if I was to tell a student what they might expect on clinical. Expect the unexpected, always. And I guess, though, to take it easy on yourself, to give yourself steps, first year, second year, third year. I know things like death, for example, that are still confronting for nurses with many, many years' experience, that yeah, you have to deal with it sometime, but the staff aren't going to, you're not going to be expected to deal with it before you're ready. And I guess to be in tune with yourself about those sorts of things. And it's much better to leave the room if there's an offensive odour or a sight or something that you can't stand. It's much better to leave the room and to call your facilitator and to go outside and have half an hour break than to fall over and hit your head and end up in the emergency department and not on clinical for the rest of the week. So be prepared for anything, but don't push yourself. Don't expect more than you've got of yourself.